Okay, so for our first test, we're going to be doing cervical compression test. For patient position, I'm going to have the patient in short sitting with good posture, so sit up nice and tall for me. I'm going to have my hands on the top of her head, and I'm going to push down for about 3 to 5 seconds. And I'm going to release, and then I'm going to ask her if she feels any pain with that. Any radiating pain would be a positive sign of the test. Next test we're going to be doing is cervical distraction. So I would have the patient lying down supine. And then I would be holding her head and cervical region with my hand and also supporting the top of her head while pulling traction and decreasing that pressure in the cervical area. You would not perform this test if the patient had a cervical dislocation or any type of cervical fracture.
Alright, so for the first test, I'm going to be doing the Spurlings test for cervical testing. I'm going to have my patient short sitting and sitting up nice and tall and straight. I'm going to ask my patient to tilt their head towards the testing side, so if I can have you bring your head down. I'm going to stand behind and I'm going to apply pressure down. A positive test would be pain radiating down the body or any numbness and tingling. So for the second test, I'm going to be doing TOS testing, so the Allen's test. So I'm going to have my patient short sitting still, sitting nice and tall. I'm going to find the patient's radial pulse. And then once you find it, you're going to bring them into abduction and external rotation of the arm. And you're going to hold the pulse for a minute and look for any reducing pulse, or if there is none at all anymore. And that would be a positive test.